Thank you, dear organizers. My senior colleague, Anil Razdan sir, Dr. Anil Garg, Dr. Guleria, with a huge salute for all the hard work that he has been doing over more than a year, and all the distinguished panelists who are here, the participants. Thank you for inviting me. Well, yes, it's true. We started our battle against COVID on 8th January 2020, and now we are more than a year and a half into it. It's been a journey of learning, of disappointments, of triumphs, and today we are in the middle of a second wave. Though our per million cases at about 10,000 are still low, our fatality rate is again low as compared to even developed countries. It's at 1.23%. And we yesterday did 26 lakh tests. Let me tell you that we had just one lab, and today we have more than 3,000. So we have ramped up our facilities. We've already vaccinated 11 crore people, which is not a small feat. But the downside is that we have added nearly 1 lakh cases yesterday itself, though 93,000 people have recovered. So COVID is raging, and I think everybody is trying to do their best. But one lesson that comes out of all this, and which is also the theme of today's conference, that how healthcare is transforming, has transformed, and must transform. First and foremost, we must recognize that health is a global good. We no longer can think that it's an individual, government, municipal responsibility, as very rightly put by Dr. Anil Razdan sir. It is a global good, which means you need huge investments, you need multi-sectoral action, you need technology, you need individual responsibility and collective responsibility, you need ethical treatment, and you need wellness in healthcare. So my emphasis is that promotive and preventive healthcare is what we should be now looking at also. So just I'll take you through this little journey as I have been witness to the transformation of healthcare in the last few years. I was fortunate to be health secretary for nearly 3 years. You see, it was in 2017 that National Health Policy was revised, and we thought about a comprehensive healthcare. I would like to say that around the world also, I think except for Thailand to some extent, nobody talks about preventive, promotive healthcare. It's only curative services. How to improve our hospital care, how to improve, disease control. We are not talking, nobody's talking about wellness. But this National Health Policy did talk about wellness, and did pick up on what was called Bhure Committee report in 1943. So I think this vision was very well articulated, and also 2018 itself, this sometimes what happens that policies don't get translated into programmatic interventions. But in 2018 itself, Ayushman Bharat was announced, a short step towards comprehensive universal healthcare. You see, it had two pillars: the health and wellness centers, which promote preventive and promotive healthcare. What was happening there? You see, we used to, as Anil Razdan sir also said, that municipalities, our neighborhoods, they used to actually take care of the primary health care of the population. And all our services were actually maternal and child-centric. But now, with these health and wellness centers, some 12 packages have been added, which includes NCD, preventive screening, and you see the non-communicable diseases. As you know, the burden is rising with our sedentary lifestyles, with the food we eat, and the way we sort of now live. So diabetes, hypertension, the cancers, that screening is done in these health and wellness centers. Today we have 70,000 already, and we are aiming at 1,50,000 odd. And then, of course, the second pillar was the Pradhan Mantri Jan Arogya Yojana, where you see the most needy 40% are covered with insurance, with trust, that government pays their money for hospitalizations for critical and catastrophic episodes. Now, the important thing I would like to say is that this PMJ is also a reflection of how government and private sector can work together. So there is private hospitals are empaneled, and they also treat people ethically at reasonable prices. So I think that's a first step towards transformative healthcare model in India. And that's what I would like to also stress here, what Dr. Anil Razdan said, that the neighborhood clinics are very important. Yes, they are to-go places. The health and wellness centers are to-go places. And I'd like to inform this August gathering, maybe you know already, that in the midst of COVID, one very important silent transformation has taken place. Under the Prime Minister's Atmanirbhar program for MSMEs, the small medium enterprises, for the first time, small clinics, family clinics have been included. So now they are eligible for, incentives, for subsidized capital through banks. So that's a big step forward, and I think that will play out in years to come. Next is that we have always been addressing healthcare disease-wise. So we had vertical programs for TB, for malaria, for handling vector-borne diseases. Of course, immunization and all was part of RCH services. And new initiatives have also been added, like quality, care delivery rooms under Lakshay, then Prime Minister's ANC program, where the private doctors give their time on voluntary basis. And then the tobacco control that we've been doing, 85% warning on cigarette packs, and more recently, the banning on e-cigarettes. So all these initiatives have been going on, but the important thing is that these verticals are now getting integrated horizontally, and that's through the Ayushman Bharat scheme that I'm talking about. Next, I'd like to also draw your attention that addressing social determinants of health are very important. Sanitation, toilets with running water, clean drinking water, nutrition, ensuring access without bias to gender, caste, class, information asymmetry. These are determinants that need to be addressed and are getting addressed. If you see this year's budget, then we've been talking about 137% increase in healthcare budget. And it's very pertinent that government has looked at sanitation and drinking water as a health component. So that's the way to go, and that's the transformation that is also required. I have already spoken about need for multi-sectoral synergy, and Anil Razdan sir also mentioned it. So some of the examples have been, where actually Beti Bachao Beti Padhao scheme, which I had the fortune to also get associated with, deals with not only, I would say, the gender discrimination or female foeticide, but also with empowerment of women, so, and education of the girl child. So the various ministries like HRD, WCT, health work together. Similarly for Swachh Bharat, similarly for drinking water. So I think all this convergence that is taking place at the government level needs to take place also at the Gram Panchayat level, in our homes, in our minds, because I feel that wellness is really, really a mindset. Then, of course, we can talk about this all, but how do we do it? So there have been reforms in medical education. There have been large scale additions, as you already know, in medical seats, both PG seats and also MBBS seats. 30,000 additional seats in the last 5 years. 73% increase in DNB. Additional PG seats to about 18,000, and new competency-based curriculum introduced after 21 years in MBBS Pan India, a district residency scheme for 3 months for PG students so that they know what it is to work in villages. And most important, of course, the National Medical Commission now has replaced MCI with outcome-based education. Not just how many rooms you have, how many labs you have, but what are the outcomes. Along with this, I'd also like to say that very recently, this Allied Health Professionals Act has come into being, the National Commission for Allied Health Professionals. Mr. Razdan said that, we need to be our own doctors, we need to be our own therapists, and I sort of agree with him. And also, we need trained people who can actually sort of assist both doctors and the patients. So, therapists, mental health is a huge issue now, especially we are all in lockdown, and we are not mingling as much. And there are new forms of communication like this digital platform. So, mental health professionals, then geriatric care professionals, then palliative care. So, these are all the this huge team of health professionals, which I have called as wellness workforce, will also now get transformed through this act, which has come into being in this parliament session. It has now become an act and a law. So this will also transform healthcare in India. So I would like to conclude that we do have a legal framework in place. We are emphasizing on preventive and promotive healthcare. Digital health is very important in COVID. Let me share with you that there is this e-Sanjeevani software that we had. We were actually doing peer learning through medical colleges through this software, but it was quickly transformed into a telemedicine network. And more than 50 lakh sessions have been held. Dr. Guleria is there. He may like to tell you how they have done a telemedicine in AIMS, how he has coordinated with all AIMS. So therefore, you see, digital health initiatives are very important. We are now insisting upon it also in our WHO panel, because even globally, the norm setting, the privacy issues, the ethical issues of digital health need to be sorted out, and the privacy law needs to come in. So all these issues are being addressed, and this is again a transformative period for all of us. I think we will. The whole world is changing, and my generation has seen black and white TVs, and today we are seeing and operating on a digital platform. I mean, how much we have seen, and I'm sure the future generation will also not be a world that we know. It will be a very, very different world. And I also want to add that one of my dreams has been, and I'm sure it'll also be actualized, is that we must have health in all policies. That means whatever government does at whatever level, central level, state level, municipal level, panchayat level, a mindful scrutiny of all proposals keeping health impact in view is very, very important. Because as we have seen, health impacts each and every aspect of our life, whether it is social, whether it's economic, whether it's mental, whether it's psychological, and of course, lives and livelihoods also has to go on together. So we are really at a very transformative stage as far as healthcare is concerned, and I'm sure that together India will move forward to show the world a new way. Thank you.
Thank you so much, Dr. Sudan, for throwing light